Let's come back to detox. And now we know the heavy metal piece, but what other toxins accumulate in the body? And then other than MSM, what can we do to eliminate them?
Correct. Now, I classify toxins by the mode by which they are excreted. And obviously, those toxins that come to the liver can detoxify and get rid of. But to do that, it needs some vitamins, it needs some minerals, it needs some essential fatty acids, and it needs some energy. And we can do that by taking a good multivitamin, some minerals, some fish oils. So that's very straightforward. But then that leaves us with a big one, which are the pesticides and the volatile organic compounds, the fire retardants, the solvents, the glues, the smellies, the perfumes, and of course the pesticides, of which the worst is glyphosate. Now, many of these are fat soluble and they get stuck in fatty departments of the body. They get stuck in our brain, they get stuck in all membranes, and they also get stuck in our fat. Now, we can get rid of those in two ways. First of all, with heating regimes. Because when you get hot, and it doesn't matter how you get hot, it might be going for a run, it might be a bath, it might be a sauna, it might be a hot shower. When you get hot, you boil them, you warm them up, and they mobilize from the subcutaneous fat onto the lipid layer of the surface of the skin, from whence they can be washed off with soap and water. So my favorite method of detoxing would be an Epsom salt bath, because guess what? Most people have a bath. Epsom salts are incredibly inexpensive. You can buy, in this country, you can get 20 kilograms for about £35, and you need about a pound of Epsom salts per bath. Soak in that, and you warm the body up. You mobilize the chemicals, as I say, onto the surface of the skin, and then they're washed off because you're in a bath. And at the same time, the magnesium gets in through the skin into the bloodstream. The sulfate gets through the skin into the bloodstream. How do we know that? Work done by Rosemary Waring, who's a biochemist at Birmingham. She took 19 of her students, and they all did Epsom salt baths every night for 2 weeks. And she measured the level of magnesium and sulfate in their blood and their urine before and after. And in every single case, the level of magnesium and sulfate rose in the blood and rose in the urine, which tells us that those Epsom salts are well absorbed through the skin. And that does much good for the body, because guess what? We're all magnesium deficient and we're all sulfate deficient. But say any heating regime will do. So if you're an athlete who goes out running regularly and then showers off, that's going to be a great way of mobilizing those nasty toxic pesticides. The problem for my fatigue syndrome patients is, they can't exercise. Heating regimes often make them ill, so they have to go very gently with it. Some of them are not even well enough to get in a bath, so that's tricky. So there's another method of detoxing, which I'm using at the moment, which I think is going to be helpful, and that's just to put organic coconut oil and actually on your skin. Now, I'm actually making up a mix with organic coconut oil and organic shea butter with some minerals and ascorbic acid as well to enhance it. And the idea here is you just rub it all over your skin after you've had a shower. And skin is comprised of skin cells, obviously, and then there's a layer of keratin and dead cells on the surface of the skin. So this oil will get into those dead cells and be mopped up by that. Just those pesticides and volatile organic compounds will get into that oil because they just diffuse through the skin. And then as we slough off our skin, because we're shedding skin scales all the time, we will literally just shed off all those chemicals. And of course, that would be enhanced by washing. So that's going to be a very cheap and easy way to detox. Now, we've got 2 studies which shows that these heating regimes are effective. The most important one was done by Bill Ray. Now, Bill Ray was a cardiothoracic surgeon in the 60s and the 70s in America. Now, in those early days of cardiothoracic surgery, a lot of anesthetic gases were used, and there was no means for scavenging those gases from the operating theatres. So all the surgeons and their assistants, they all had a dose of anesthetic gases as well. And he was literally poisoned by those anesthetic gases, so much so that he developed a multiple chemical sensitivity. And that meant he couldn't operate anymore. So he had to finish as a cardiothoracic surgeon, and he set up the environmental center in Dallas, in Texas, which is still in existence today. Because he had multiple chemical sensitivity as a result of this poisoning, he accumulated patients who were similarly affected. And he accumulated 210 of these patients, and he put them through this very detox regime. So so they were doing heating regimes, which for some it was on an exercise bike, for some it was in a sauna, and then showering off afterwards. He also did massage. So the patients, so they had three things: they had the massage, they had the heating regimes, and then they had the saunaing. And what was so interesting is that the massage therapists often used to comment, "Oh, a massage," and suddenly they get like this outburst of some smell, as if the smell was just coming out of the body. They suddenly could smell petrol fumes, they could suddenly smell diesel fumes or perfumes or something, as if they kind of mobilized the hot spot of chemicals so much so that they could smell them. What was so interesting is that 200 of those patients got detox regimes. They got initial worsening. And then they saw improvement subsequently. And he was measuring levels of chemical in the blood before and after, and again, they reduced their chemical load. So we've got some good hard data showing that these regimes are effective. I've got my own figures, which I've collected. I've only got 32 patients, but I've done some sort of test of toxicity before and after, either fat biopsy, DNA adducts, translocated protein studies, or whatever. And pretty much in every single case, the toxic load has come down. So we know these regimes are effective. So these days, I don't do the tests anymore. Why? Because the tests are expensive and my patients are poor. I just say, get on and do the regimes, do the heating regimes, and roughly speaking, 50 such heating regimes will halve the total load. And the numbers come down exponentially. So if the total initial load was, say, let's call it 64, whatever, after 50 regimes, it comes down to 32. Another 50 regimes, it comes down to 16. Another 15 regimes, it comes down to 8. You never get to baseline. There's always a little bit there because we're constantly toxing up however much we try not to. But again, if it's sufficiently low, the body can deal with that.
And for somebody that's new to this and they start these regimes, do you like them to space it out a little bit to give their body time in between? Because you've given the numbers now and some people might be in a rush to get through a certain number of them. How do you feel about timing?
It depends on how sick they are. It's the old formula: the sicker they are, the slower you go. And for some people, they're so sick, all they can manage is just putting their feet in a bowl of hot water with Epsom salts in it. And when they tolerate that, then they can do a little bit more, and then a little bit more. Another useful way of doing this for the very sick patients would be a far infrared sauna. And for some people, all they can do is just put their legs in initially for 2 minutes, and that's as much as they can tolerate. And then as they gradually improve, then you put more of the body in for a little bit longer, maybe at slightly higher temperatures, until you get a result. But yes, for the sick people, you start low and go slow. For somebody who's otherwise well, I say, just go on and do it, boy. The quicker we get these toxins down, the better.
Okay, so we have our 3 big supplements we started out with. You've now brought a handful of others in, including a multivitamin, the Epsom salt, you said fish oil, and there may have been another 1 or 2. What I'm getting at here, other supplements as part of a maintenance routine for people, or in special cases, things you'll introduce?
Well, the fact of the matter is, because we live in such a toxic world, and because we live in such a micronutrient deficient world, we all have to take a package of supplements just to get on the starting blocks. And yes, that package is a good multivitamin, a good multimineral, fish oils, vitamin C, iodine, and most importantly of all, vitamin D. We are all sunshine deficient. And my view is we should all be taking 10,000 IU a day of vitamin D. At that level, there have never been any toxicity or problems whatsoever. It's equivalent to about half an hour of sunshine. How much sunshine did primitive man get? Well, they got 12 hours a day, didn't they? So you're not going to get any problems at 10,000 IU a day. And vitamin D is highly protective against infectious disease, COVID, of course, cancer, heart disease, dementia. It's a proven benefit. So that's just what I call the basic package of supplements to get on the starting blocks. And then if you've got a specific problem after that, like fatigue, okay, there are other packages we can add in as well. But if you can do a low carbohydrate diet, clean up the upper fermenting gut and take that basic package of supplements, that's going to get a lot of people an awful long way.
Okay, it sounds like it, but just to be clear, that 10,000 IU for you, vitamin D, even in the summer, you'll still take that?
Yes, because the body makes as much vitamin D as it needs from sunshine, and then it stops making it. So you base load with vitamin D as an insurance policy, if you like, and then you can get as much sunshine as you like, obviously without burning the skin. Get as much sunshine as you like. That will top it up to optimum, and then the body just ceases to make it once it has a sufficiency.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The upper fermenting gut is a major, major problem. It goes almost unrecognised by the conventional doctors. We have to get rid of the upper fermenting gut. And yes, there's a two-pronged approach. Yes, we starve them out with a low-carb ketogenic diet. And secondly,